Hello and welcome to World Insight with me, Tian Wei, coming to you live from Beijing on CGTN. Coming up on today's program, an unusual flu outbreak sweeps Chinese cities and other parts of the world, overwhelming hospitals in some communities. Why the quick viral spread and why now? And it may be one of Europe's smallest states, but Luxembourg is big on plans to source minerals from outer space. I catch up with Luxembourg's Deputy Prime Minister, Etienne Schneider, about his country's ambitious asteroid mining plan. This is World Insight. It's flu season in China, and the country's hospitals are being inundated with patients looking for some relief. Authorities say there are more cases now than at any other time this winter and aren't sure when the numbers will start to drop. In an effort to contain the spread of the virus, they are urging people to be alarmed with the most basic protection.
Chinese health officials expect flu cases to trail off in the coming weeks. Since winter started, doctors have seen a spike in patients, and some hospitals have even run short of medicine. Authorities are encouraging children and the elderly to get vaccinated. Health officials say the flu outbreak has reached its peak and should ease due to the upcoming winter vacation. Meanwhile, the flu bug continues to sweep through many Western countries this winter. According to the Centers for Disease Control and Prevention in the U.S., about 100 people, including 13 children, died of flu-related ailments across 46 states. In Canada, over 10,000 have had flu and 10 died of it. The situation is also serious in Europe. In Britain, the flu has affected over 4 million people and killed 85. Local tabloid The Mirror said the country may face a flu epidemic later this month. In France, 10,000 people reported sick, with 1,000 hospitalized for the flu.
How bad can the winter flu outbreak get? Let's turn to our panelists joining us from here in China and elsewhere in the world. In our Beijing studio, Fang Hai, who is a professor at the China Center for Health Development Studies at Peking University. Welcome, Professor. Also joining us here in Beijing, Dr. Fabio Scano, the officer in charge of the World Health Organization China office. Every time we have emergency, we have you here in our studio. Welcome. Joining us in Washington, D.C., Dr. Kate Tulenko, who is the CEO of Corvus Health, that is global health advisory firm. And also in Paris, we invited Dr. Eric Ding, welcome back, an epidemiologist who is also a health economist from the Harvard School of Public Health. I want to welcome all of you. Okay, everybody's saying this year the flu is severe. Is it true? This year compared to the same period last year and a few years back? Dr. Scano.
Let me address the anxiety and somehow the fear that there is indeed behind this question. What we are seeing is the peak of the seasonal flu in China, and as the word alludes to, it means that it is seasonal and it happens every year. Yeah. Of course, for the family affected by the flu, this is very challenging. What we know is that there is not just one strain of influenza circulating. There are actually multiple, and these strains, they change very quickly. And when they do so, our body doesn't recognize them, and our immune system cannot protect us enough. The good news, at least for China, is that next week the holiday season for the schools will start. And historically, we have always seen a drop in the number of cases following holiday season.
Dr. Scano, you're not answering my question directly, because the question is quite obvious. It is, are we having more severe situation than we used to be, let's just say last year compared to? Are we or not?
Let me put it like this. Every year, the WHO estimates that there are some up to 600,000 deaths due to influenza, and some 5-6 million of cases that are severe. First of all, the influenza season is not over yet. Yeah. We saw that last year, as we are seeing that also this year. So what we are seeing is, yes, that there is a strain on the health system in China like also elsewhere.
All right.
But what we are also seeing is that there is time for the people to get vaccinated and to use precautions, simple ones, to avoid the spread.
Got it. The health experts just do not want to give a yes and no answer, as simple as that. Let's go to you, Professor Fang. What about that? Are we reaching the peak? Do we know?
Maybe it's a peak, may not be a peak. That depends on how you calculate.
That is a question, isn't
right,
it?
Right, definitely.
The peak or not the peak, that is a question. Yes, so explain, please.
But when you have it, when you suffer it, you think it's very serious for you. But when you don't have it, or maybe several years later, you think, oh, it is just normal. So we have to use the figure to show.
What are the figures telling us right now?
The telling us is that, yes, it is indeed, there are more and more infections for the flu in China and also in other countries. But the number of infections has been decreasing in China. Yeah, particularly in the last 1 or 2 weeks in major cities in China.
I see.
This is reported by the CDC and also by the National Family and Health Commission.
So it's very likely we have already reached the peak and possibly on its way to drop, particularly when Dr. Scano say the school kids are going to enjoy their winter vacation, which means they're going to be separated from one another. So it could help not to spread further the flu virus. Having said this, let's go to our guest in the United States, Dr. Tulenko. It's not just China, in the United States too. This winter, people, particularly you see the headlines in the news, it is getting really severe. Is it?
Yeah, so in the United States, fortunately, the vaccine that we're using does indeed cover the most prominent virus, the H3N2. But unfortunately, it's not giving as good coverage. It's only covering about 20%. And so people are still getting the flu. And this type of flu particularly hits children and elderly people very hard. And so I think that's why you've seen some of the challenges. And also in the U.S., frankly, we need to increase vaccination rates. Flu vaccination rates are only about 40 to 50% in adults and about 60% in children. One thing that has made a big difference in the U.S. is a few years ago we made it legal for pharmacists to give the flu vaccine, and that increased the percentage of adults getting flu vaccine by about 8 or 10%.
All right.
So improving the health systems and expanding access makes a big difference.
Before we go to what is already the solution, I still want to push that question, Dr. Tulenko. Tell me if it is too simple an answer, a question I seek, which is, are we seeing more severe reality when it comes to flu and the spread of flu in the United States this winter compared to a few winters back?
Well, this is certainly the most severe season in about 4 or 5 years. So to that question, yes. But I think in the future we probably can expect more severe seasons, most likely due to just the global aging. Many countries, the U.S., China, Europe, populations are aging, and these groups are much more vulnerable to catching the flu and having more severe flu and dying from the flu. We also see a great deal more travel. When you think about it, the Spanish flu, which was this global pandemic that sickened 1/3 of the world, happened 100 years ago, happened in 1918, occur before people were flying, before major transport was possible. So you think now, so many people travel every day, so it's going to make it much more likely that any type of epidemic, whether the flu or other type, will spread.
Dr. Ding, though, are we better equipped with capabilities to prevent, first of all, and secondly, to cure flu, or help at least people to go through the pains of the flu? Dr. Ding.
Yeah, I think our public health system is somewhat ill-equipped to deal with major epidemics. For example, hospitals do not have the surge capacity, and again, the vaccination rates, as the previous panelist mentioned, is very, very low. It's only 40% among adults, 60% among kids. And even then, especially right now, every year when people pick out vaccinations, when scientists predict what vaccines to make, they can only guess what vaccines. So altogether, I think our public health infrastructure is poorly equipped for this. And the CDC right now has I think stepped up somewhat, but I think they're still understaffed, and I think nationwide doctors are just not as prepared. And nutritionally, in terms of, vitamin deficiencies, vitamin C's and vitamin D, which all affect immunity,
right,
these deficiencies are all up as well. So we have to solve many aspects, not just hospitals.
Exactly. Every time when we talk about a health issue, a health hazard, actually there are a lot of branches issues related to it. Every one of them is hard to handle within one time. But it has to be done and has to be resolved in order to make sure the health hazard could go away or would not hurt us as much as they do right now. So I want to go to you, Dr. Scano. Earlier, Dr. Ding already mentioned about vaccination. And vaccines, 6 to 8 months. I was talking to you in our pre-communication before coming over here. You are helping me to understand the length of it to develop a vaccine. Of course, that would mean you could guess it right and you could guess it wrong. And some you could cover well, maybe some year you wouldn't. So is vaccination really the way for us to face up to this challenge of flu? Or actually we have other means, probably even more effective than just guess every year?
Well, we know that vaccine is the most effective means, even if some years is spot on, which means it covers all the strains, and some other years it might not cover the predominant strain, but it's still protective. What is important is the coverage. So as the other panelists were saying, if the coverage is very low at population level, it will not have an effect. And in particular, I'm referring to the older population, above 65, that they should have access to the vaccine. This is a problem of availability of the vaccine where they live, but it's also a financial burden that there could be there.
Vaccine is always a big issue in any country, and there are industry issues related to it, there are market issues related to it, governance as well, a lot of complicated things. Dr. Ding, though, vaccines, at this point, what data are we relying on in order to, quote, guess? In other words, trying to come up with the most possible virus that is likely to be spread around for the next year?
Well, when they have to manufacture these vaccines, they actually have to manufacture it many, many months before the actual epidemic can even starts in the Western Hemisphere. For example, Australia, the flu season peaks in August, but the vaccine that we have to design is based on basically last year's data of what is the likely emerging strains, and it's terrible to predict.
And where do those data come from? Where do those data come from? From the WHO, from somewhere else?
Just sampling. I think from sampling worldwide, worldwide trends. But again, you have to actually incubate these vaccines.
That's right.
Many, like almost 9 months ahead of time. So it's very difficult to predict. And this year, 80% of all the the flu strains are H3N2, which again is not covered under the main vaccine. Right now, the vaccine only has 30% effectiveness against H3N2. And someday what we need, and these are in the pipeline, is a universal vaccine for influenza. And that's still several years out. But I think, within the 10 years, we'll likely have a universal vaccine. And then this guessing game we will hopefully put to an end.
Really? Would that work? Dr. Scano?
The vaccine definitely can prevent a viral infection.
But it has to be the right one.
It has to be the right one, but still it covers strains, even if it's not spot on. So we shouldn't underestimate the usefulness.
I see. But on the other hand, Dr. Tulenko, vaccine is always a political issue. It's also a business issue because you don't want the business community to rip people off at the time of big flu season. You also don't want the government to put a artificial cap on the price of the vaccine because that would make people, the business is dead. Nobody is going to have the incentive to produce even more. So it's always a big, complicated industry, politics, societal thing going on in every country we see. So Dr. Tulenko, without solving that complicated, intertwined interests, can we really help to let vaccine be the solution?
Well, there are a number of things that governments can do to de-risk the vaccine industry. You know, some is to provide insurance coverage for the companies. The other is to provide advanced market commitments, which are guarantees to buy a vaccine at a certain price if a vaccine is created that has a certain level of efficacy. So yes, there are measures that governments can take. And also, there are non-vaccine measures as well. For example, helping people stay at home. In many countries, people don't have paid medical leave, and if they don't show up for work, they get fired or they don't get paid. And there's a lot of evidence that allowing people to stay home when they're sick prevents spread and actually increases productivity. And also, there's a lot more we can do about schools and offices and companies making sure there's hand hygiene stations so that people can sanitize their hands and reduce the spread of the influenza in these gathering sites.
It sounds like same old, same old. I mean, ladies and gentlemen, you told us the same thing every year, but every year we have to seek your advice because every year we see a new kind of flu, and we're curious what needs to be done. But actually, what you have advised last year, still this year, have not been done efficiently. So same thing has to be said, same advice has to be given. Having said that, though, Professor Fang, I want to come back to you. 2003, China was experiencing one of the most dramatic health hazard in its recent history, the SARS, the spread of SARS. Of course, it is totally different from what we are talking about today, but it really alarmed the people, and also it really alarmed the system. Have we learned something from there and would help us and equip us to deal with, you know, the ordinary, shall we say, flus that we see every year? I'll go to you also later, Dr. Scannell, about that question from the WHO perspective. Professor, go ahead.
I think the information is very important from the authority, from the government, and from the government agency. So we have to let the people know that, okay, what is the truth and the transmitted information to all the people in our country.
Transparency, in other words.
Right.
Don't let the rumors spread around.
Right. Second, we should have a very, very good primary care, not like the hospital. So most of the people now, they just rush into the hospital for flu. It is really not necessary. So you can treat the flu. I'm not seeing the hospitalization. You can treat the flu in the primary care, in the community hospital or township hospital without any problem. But now the problem is when you have a fever, when you have a flu, when you go to the community hospital or the clinic, they just refer you to the tertiary hospital for treatment. That is the second problem. The third problem is we have a shortage of some of the medical staff, like pediatricians. A lot of hospitals, they don't have very, very good, or even they don't have any pediatric department. So the kids should be treated in the tertiary hospitals, or the parents just send their kids to the tertiary hospital for treatment. So a lot of people crowding into the hospital for a minor disease. That is really the waste of the resources.
But I'm sure you understand the psyche behind this, because everybody is so concerned that my kid, my only kid,
right,
it shouldn't suffer from any flu, and I don't want to see any consequences as a result for this kid in the future when it comes to health.
But still the information. So you have to tell them that, okay, this is a flu, not the SARS. Second, a lot of people, they even don't trust the vaccine, right? A lot, like in Beijing, the adults, 65 years old or 60 years above, all the children, school children, they can get the flu vaccination. However, as I know, the taking up rate is very, very low, right? Because they don't trust the vaccine.
It's not because of there is no availability, but rather the lack of trust about the function of vaccine.
Even though some of the medical students at Peking University, when I tell them, okay, you should have the vaccine, they say no.
Okay, all right. Awareness, transparency, the understanding of ordinary daily, annual flu season, these are all important. But what has China learned? I mean, think about it, 15 years ago already. And does it help also for WHO at that time and even today to help its system to smooth up about prevention and also cure of flu, influenza?
For sure. What happened 15 years ago has been a wake-up call not only for China, but for the entire world. And highlighted the fact that the solution cannot come from one country only, but it has to be a global response to a global issue that is like seasonal
influenza. Can you really coordinate? I mean, we are talking about a fractured world right now. We're talking about our country first. Everybody is saying, that seems to be the slogan. So can that still be done when it comes to health issue?
It's not just a slogan. It's much more than that. And I think there is a lot of contact over the last decade, and so for having countries better prepared, not only China and developed countries, but also only developing countries, where they have a very fragile health system, and we have seen how important a fragile health system is. So there is a role, absolutely, for a global platform to share best practices, experience, but also data, to make recommendations for a future. There is hope and also a need for better research to have a better vaccine. There is a role for government to play to provide the vaccine to the people where they need it. And there is also a role for the people to have a responsibility to get the right information and truthful information about vaccine. Because we have heard that there is a lot of misconception and somehow not evidence concerning the perception of vaccine in the country.
You think about it, ladies and gentlemen. I mean, the human being has been suffering from influenza from the very beginning. And we are still facing that danger, which really put us a big question mark over there, Dr. Ding. Are we really more capable of dealing with ourselves, our own future? Are we more in control of our own fate? Or actually, we are exactly as where our ancestors were, hundreds and thousands of years ago, about our capability to prevent the disease and cure disease, Dr. Ding. Maybe that's too big a question, but I think it's relevant to raise it up.
No, I think it's a relevant question. I think our society has to face these challenges. And again, vaccine is one aspect, but you have to realize the flu evolves and adapts. If it was a constant virus and never changes, we would have eliminated it decades ago. But and because the flu evolves and adapts, we have to evolve and adapt. And we have to be better prepared, whether it's from public health infrastructure, better quarantine systems, better paid medical leave so people don't feel pressure to come to work and spread the virus, and of course better vaccine design and better nutrition, because better nutrition is the hallmark of immunity that helps prevent the spread in addition to these vaccines. And again, I think universal vaccine, we are less than 5 to 10 years away from universal flu vaccine, so that covers all flu influenzas. So I'm hopeful when that day comes, we'll have a precipitous drop-off in these worldwide pandemics.
Okay. I got 2 simple questions for every one of you. We only have less than 2 minutes left, so very simple 2 questions to everyone. One is, what can we do now to prevent flu from happening to us this year? Secondly, what needs to be done long-term, the most crucial to you? Let's start with Dr. Tulenko in the U.S. 2 simple sentences.
So we need to vaccinate, and we need to help people who are sick stay home. And long-term, we need a vaccine that will be good against all the flu viruses.
Oh, wow. That's a big goal. And Dr. Ding?
Likewise, a universal vaccine, but also better nutrition and better public health monitoring.
Got it. Professor Fang?
We have talked about a lot of things, but I just want you to wash your hands frequently and drink more water.
And that is going to be crucial.
Right.
As they have been crucial for hundreds of years.
Right.
Exactly. Let's go to you, Dr. Scano, finally.
To get better prepared, to find ourselves next year or the years to come, not in the same room to talk about the same thing.
I hope not on the same thing anymore. But it's such a pleasure, shall I say, ladies and gentlemen, to have 4 of you joining us from different corners of the world, helping us understand this issue, always important for us, the health of human beings. Dr. Fabio Scano, Professor Fang Hai here in China, and Dr. Kate Tuleno in the U.S., Dr. Eric Ding joining us today from Paris. Really appreciate it. Thank you so much. Keep healthy. Keep yourself healthy. So together with your family and friends. Thank you. Stay with us here on World Insight with me, Tian Wei. Still to come on our program, I sit down with Luxembourg's Deputy Prime Minister, Etienne Schneider, to talk about his country's big plan to source minerals from outer space. Get up to speed on Luxembourg's, as the world minded right after this break. Welcome back. You're watching World Insight with me, Tian Wei, coming to you Monday to Friday on CGTN. Luxembourg is one of Europe's smallest countries that used to build its economy around iron and steel, but don't let its size fool you. It's eyeing outer space to source minerals through asteroid mining. The first mission is expected within the next 3 years. Much of this effort is due to Etienne Schneider, the Luxembourg's deputy prime minister, who wants to turn the country into an outer space powerhouse.
One of Europe's tiniest states now holds claim to being a giant in the space industry. Luxembourg, known as the leading private banking center in the Eurozone, now generates nearly 2% of its annual GDP from the space industry, the highest of any country. Luxembourg's Space Resources Initiative is its plan to position the country as the European heart of exploration and use of space resources. Space mining is Luxembourg's present focus. From around 30 companies in Luxembourg's space sector, there is a vast pool of talent and expertise in satellite telecommunications. They draw on the pool for the development of extracting resources from the moon or from thousands of asteroids. The first asteroid prospecting missions are expected within the next 3 years. Eventually, celestial mining firms hope to harvest materials that can be processed in space and then used for on-site construction to sustain human life in space or, in the very long term, shipped back and sold on Earth.
Mr. Deputy Prime Minister, welcome to CGTN.
Thank you.
You have been nicknamed by some as the space miner in your country. How did that name come from?
Well, I guess it comes from my Space Resource.lu initiative, which I launched some 2 years ago, where we really want to bring our country into space, meaning that we want to develop commercial activities in space. And that's an initiative we took 2 years ago, as I said, and which has a tremendous success.
But people would say that's quite ambitious for a country like Luxembourg and having an outer space plan.
35 years ago, we launched, as a government, together with private investors, the satellite company SES, which is now one of the biggest commercial satellite operators in the world. And that was, at that time, a very ambitious idea. And many people didn't believe in Luxembourg being able to develop this kind of space activities, but now we are one of the leaders.
There are several things that you need to handle, I guess, Mr. Deputy Prime Minister. One is the international legislation, whether we have some agreements about that. Secondly, of course, technological. And thirdly, what about the international cooperation in terms of developing it, because Luxembourg will not be able to do it alone. Mm-hmm. So all of these, how could it happen?
When I was discussing with many different startups in this kind of business, they were telling me that they've got some problems to find investors because the property question is not solved by the United Nations Space Treaty, which dates back to 1967. And at that time, doing business in space or doing space mining was just science fiction. So nobody was addressing this question. So what we did was in analysis of the international legal framework, and then we decided to get a proper legal framework in Luxembourg, which allows companies to harvest minerals, for instance, in space and to own them, to possess them, and to commercialize them. Mm. And that's a very, very important step in order to allow these companies to develop themselves, in order to make their lives easier because they need to find investors. Mm. What we are working on right now is to put in place a fund, an investment fund, in order to invest into these startups. And that's what we are discussing right now with different investors. And I guess we will have this fund in a few months' time.
What kind of scale are you looking at in the very near future?
We want to be, let's say, the host nation of all these companies which want to develop space business in space. But what we are doing, and that's why I'm here in China today, is signing agreements with other like-minded countries, with countries with whom we can cooperate and collaborate in order to develop all these techniques and technologies.
Because what kind of areas can you develop with China? I understand you're here to discuss with the space agency here in this country.
You know, there's quite a lot of different areas where we want to cooperate. For instance, exchange of information, then working together on research and development activities, putting our forces together. My aim is to bring all the like-minded countries around the table and to discuss together with them what are our aims, where do we want to get, and how can we do so as soon as possible and as cheap as possible.
Now you see a lot of debates in Europe when it comes to immigrants, when it comes to how to solicit the best talents from around the world. How do you, as the Deputy Prime Minister of your country, see that issue?
We have always had a completely open economy. We have always been completely open to all kinds of investors and also to all kinds of people who wanted to work in Luxembourg.
But now people say the trend is different. The wind is blowing the other way around. People want to say, my country first.
Luxembourg counts now 47% of foreigners living in the country, and we don't even have a right-wing party which is fighting against these foreigners. So, you know, everybody in Luxembourg knows that we need this foreign workforce, we need this immigration, and we need foreign capital to be invested.
What about outside your country? You're part of the EU. I mean, you cannot draw on your own policy just like that. You have to negotiate with the rest of the EU countries. Yeah. What about that part?
I must tell you that it's something which makes me a little bit sad. If I'm seeing these more nationalistic debates getting back into the European Union, in some of the European Union countries, I can just tell them that it's not the right way to go, and it has never been a solution to anything.
But the question is your voice big enough, Mr. Deputy Prime Minister, inside the EU?
Yeah, apparently not. Apparently not, because otherwise some countries would not close their doors as they're doing or trying to do right now.
So
but
what can you do?
We are fighting for it. We are fighting for it on the European Union level. But as you said, we are a small country with small voting rights. But on the other hand, we are trying to convince other countries to stay open and to not abolish immigration. Because, you know, Europe is quite an old continent, and people are getting quite old, or are quite old in
aging
Europe.
population.
Exactly. Aging of the population will be a big issue in the years to come. So we should be a little bit wiser and a little bit more forward-looking.
Okay, the scenario is people will listen to you, or they see their own interest in listening to ideas like what you have just said. The other scenario is they wouldn't. There are only two options. And therefore, how would Luxembourg be able to function if the option is not the best one that you would prefer?
Nobody can forbid Luxembourg to be an open country and to accept immigration into our country. So, you know, if the other countries don't want to understand how important immigration is, not only for the economy but also for the survival of their countries in the long term, we understand it, and we will continue having immigration in Luxembourg.
And therefore, there are very confusing political landscape in the EU as to who will be the leadership, who has the quality of being the leadership, which direction will the leadership lead the rest of the EU to go, even though it is a very equal membership entity. So, Mr. Deputy Prime Minister, what do you make of this apparent chaotic situation? What is the logic that Luxembourg is keen on among all these mixed up pictures?
The years after 2008 have been very difficult for many of the European Union countries. And so the country is more and more divided on different important European topics.
That's right.
And we are quite happy to see that finally France and Germany seem to go into the same direction, meaning that Europe must become stronger again. But still, you're right, there are some countries which are going into the other direction. And that's a problem we will have to tackle. But the good thing is, you know, governments come and they go again. So the policy is changing also every 4 to 5 years. So if you have countries which are, let's say, more Eurosceptic, you have the chance that maybe a few years later there will be another government which will be more favorable.
Luxembourg, of course, is very keen on designing its own blueprint about its own future. In this big picture, where does the relationship between Luxembourg and China fall?
China was always a very good partner. And there was a big difference, I guess, between Luxembourg and many other, or let's say at least many big European countries towards China. Because many of them want to protect their economies against Chinese investors, because they want to protect their national champions. We never had national champions in that way, apart from the steel industry.
Right.
But you know, we never closed our doors, and we never tried to avoid Chinese investments in Luxembourg. The opposite is the case. We are coming to China in order to find investors which might use Luxembourg as their European hub, as their gateway to Europe, and we really help them to develop their activities.
Right.
And I think that's a big difference between many other countries. We never had any single problem with one of our Chinese investors in Luxembourg. And you know that the Bank of China is the first Chinese bank outside of China. And it was, they came to Luxembourg, and Madame Zhou Lihong, who is the CEO of the bank, she's a good friend of mine, because due to all our collaboration, due to the fact that we really have very tight links to our Chinese community in Luxembourg, there's mutual trust and understanding.
Right. But what about the Belt and Road Initiative? There are different views about that. Some of those from Europe might be skeptical about it. What is your view, Mr. Deputy Prime Minister? What does China want to do you think, with this?
You know, first of all, we fully support this initiative because we think it's the right way to do. Second, and here again, Luxembourg was the first non-Asian country to become a member of the Asia Infrastructure Investment Bank. So there again, and I can tell you that there was some pressure from some other countries.
What kind of pressure?
Pressure not to become a member of this.
Remember at the time when you were making this decision, what was the pressure that you were facing at the time?
You know,
would you like to describe in words to me?
I will not tell you which country, but it was a very big country, which didn't really want us to become a part of this initiative. But, you know, we didn't care about that because, as I told you before, we have a really good experience with our Chinese partners, and that's why we wanted to show that we will continue supporting China in developing their activities. And the One Belt, One Road initiative is really something which we think will be in the interest not only of China, but of all other countries which participate in it.
Which stage do you think that has already been developing to?
Well, that's a good question. That's a good question which I will not be able to answer to you right now because, you know, I don't have the insight into all of these activities.
There are some issues, as you said, sir, you're very keen on, and yet maybe different compared to some of the other countries. One of those is about what to do with tech companies internationally. People see these companies are becoming sometimes even bigger than middle-sized countries, and data providing a lot of power. But at the same time, they also provide a lot of convenience to people that are using these services. How do you see, as a national leader, the growth of these kind of companies and the relationship between countries, governments, and these businesses?
You know, I don't really see a big problem having these big companies. I see more problem in cybersecurity, protection of information, of data. All this will be, or is already, a tremendous challenge for the countries in order to regulate all this, and you know, in order to make sure that your data is not used when you don't want it to be used by others. So I see the problem more in that perspective. And then maybe on the maybe there's another problem. We have to make sure that these companies also pay taxes somewhere. Because,
and that could be an issue. for example, your country is related to right now.
Absolutely. That is an issue, and that is an important issue. And we have to make sure that these companies have to pay their fair share somewhere. But nowadays, with all the possibilities they have, and due to the huge impact they can have on nation states, they are quite successful in avoiding taxes. And I think we should find a way to make them pay their fair share wherever they are active. Not in one single country, but wherever they are active.
So thank you so much, Mr. Deputy Prime Minister, for being with us. And that is all the time we have for today. If you'd like to see more, try to find us World Insight CGTN into your search engine or check out our YouTube channel. You can also follow us on Twitter, Facebook, and Sina Weibo. From me, Tian Wei, and everyone on the World Insight team, thanks for watching. Tune in again next time for insights across China and around the world. Good night.